The first episode of the iconic show Pose features the character Damon at his suburban home in the 1980s, sitting on the couch with his parents. During their conversation, Damon chooses to tell his parents that he is gay. Instead of feeling supported and affirmed for his identity, he is suddenly stricken from the home, jousted by his father for being a gay man. Estranged from not only his home, but his parents' love, Damon finds himself exploring the literal streets of New York City in a state of survival and wanting to find acceptance. So are and have been this reality for numerous LGBTQ+ individuals across the globe. One of the strongest forms of security we have in life, having a home, is something we all cannot live without. The benefits of housing are manifold: economic, spiritual, familial, emotional, but most importantly, health and well-being. Living in poor housing can bring along mold, asbestos, poor air quality, and overcrowding associated with a number of chronic conditions or injuries. Imagine you are a person living with a chronic health condition. How can you safely store medications without a storage closet? One of those medications must be refrigerated. Or if you don't have shelter, your chances of developing diseases of the immunocompromised, such as tuberculosis and pneumonia, or exposure to the environment like frostbite and heat stroke, increase dramatically. And most importantly, where can you safely go to sleep? It can also be impossible to qualify for health insurance without an existing address. LGBTQ+ individuals within their lifetime are more likely to experience poverty, lose a home, or be denied on housing applications to start. We must address the implications of LGBTQ+ individuals living unhoused as a health disparity. For example, many queer people without housing may resort to sex work if it means having a place for the night at the risk of acquiring an STD or HIV. The creation of policy, advocacy, and interest towards amending this problem has been steadily growing over the past number of years in the United States. Recognizing the need for places for queer people to live without being discriminated against, entire housing centers have been dedicated to creating affirming, sustainable housing communities for queer people of all ages and backgrounds. Our guest today, Jim Harvey, has been a public health leader in this space and will be speaking with us today about why these housing facilities exist and how they improve the health and well-being of our queer loved ones. Hello. Hi, everybody. Welcome to the season 2 of the Equerity podcast. Super happy today to be talking to Mr. Jim Harvey. Welcome.
Thank you. Thank you so much, Renee.
Of course. Of course. And is it okay if I call you Jim during the conversation?
Absolutely.
Awesome. Awesome. So let us introduce our guest today. So Jim Harvey is executive director for One Roof Chicago, a Chicago-based development nonprofit that is currently building intergenerational housing and services for LGBTQ+ seniors and young adults. He is a master's level public health professional with more than 35 years of service to community health programs funded by the CDC and the Bureau of Primary Health Care. He oversaw the development of the Capacity Building Assistance Program and managed a division of the CDC's National Prevention Information Network for several years. He also consulted for the Chicago Department of Public Health and the Georgia Department of Human Services Minority Health Division. Jim was a co-founder of the Greater Chicago Committee and introduced the Bayard Rustin Awards there. He also remains a member of the DC-based Rainbow History Project. Jim began a career in domestic violence prevention counseling and group facilitation in 2010 in Chicago, and retiring from his public health career, and has since also become certified as a restorative justice and conflict mediation facilitation trainer. And this is really important, especially for today's episode. Mr. Harvey is a longtime organizational development consultant to nonprofits and NGOs, which has taken him to South Africa, Jamaica, and numerous cities in the U.S., much of which helped prepare him to lead in the development and completion of a residential housing and social services program for LGBTQ homeless youth in New Mexico. Jim Harvey recently served as Associate Director for a Domestic Violence Prevention Program, where he also facilitated men's groups, along with program administration at multiple levels. Jim is a native of Chicago, where he resides with his spouse of 24 years and their 4 dogs and a cat. He is also an avid collector of art from the African diaspora. And he's here to talk with us today about our topic that is centering on LGBTQ plus unhoused youth and older adults in the US and in the world, because it's a huge issue, as we know about. And he is going to give us a great discussion on that today. So thank you so much for agreeing to be on today. How are you?
Thanks so much. I am just fine. Just fine. Excited about things to come.
Excited about things to come as well. So, why don't we just start more on your background, which is really extensive and you've done quite a lot. So, that's amazing to hear about. Before your current position as executive director of One Roof Chicago, you had previously done work leading the creation of homes for unhoused LGBTQ plus individuals living in New Mexico. I'm curious, how did that particular need come about? Was that something that the community reached out and said, this is a huge issue that we're having? Or rather, were you already doing work in that area and you and other people noticed that there was something going on? I'm curious about how that program and that facility came about.
Well, I'll probably mention this on several occasions during our time together today, but social justice is my middle name. And,
Awesome.
and so I'm a big advocate of and activist in the social justice world for that matter. But New Mexico, like Arizona and other places in the Southwest, are like havens for people who don't necessarily have a place to live. The weather suits the opportunities for them to, if necessary, live on the streets and get good responses from local communities in terms of free food and maybe even shelter from time to time. But as I was living in Albuquerque, some other people came to me and said, we've got to do something about young LGBTQ youth in this area because they're living on the streets and they're not being offered the same opportunities as everybody else simply because of the fact that they're queer.
Right.
And on any given night, you'd have as many as 1,000 queer youth in a small town like Albuquerque living on the streets and not being able to get any services. So folks came together and said, we're going to do something about it. And I said, I need to step up and do what I can. And my big mouth got me right in the middle of it all as their first executive director.
How amazing that you were able to step in and help with that need. And it's surprising to me. I'm not sure if it's because I haven't been to New Mexico or because I simply am just now really getting into this topic, but there are many unhoused LGBTQ plus youth in our country.
Oh, there are. Everywhere you go, it's a real challenge. And it's a challenge because of homophobia for the most part. People are
Mhm.
still very homophobic. And if you go to certain cities, certain communities, particularly red states, and thank goodness New Mexico is not a red state. If you go to red states, you'll find that, right up through the government, there's a lot of discrimination. And so people are constantly faced with that and fighting to just exist.
Certainly. There's a lot of discrimination still occurring, and there's a myriad of reasons, right? Why some queer youth might be not in the home, and some of them may not be in the home for choice, but some of them also may not be in the home because they don't have a choice. And in those situations, where do they go? And so it's pretty important that we have individuals stepping up and saying that we need facilities to care for these people and provide community for them. And so that's the great part about providing housing for the unhoused in our community. I am curious. You did mention homophobia is a huge implication in that sort of occurrence of becoming unhoused and people living on the streets and being rejected. I'm curious if you saw other sectors within the LGBTQ community, including trans people, and did you hear about maybe transphobia or maybe other sort of communities within the community that were experiencing discrimination, kind of like the homophobia? Like, was it really homophobia that you were seeing? Were you seeing anything else that was going on?
Transphobia is even bigger. It's huge, huge, and a huge issue. They make it real because they're so loud about it. They make it real because they're so organized around it. and that becomes a problem. So initially, if you go back to the height of the HIV and AIDS epidemic, families,
Hmm.
parents, neighbors, people in schools, you name it, people got really excited about the fact that here was an unknown disease that seemed to have had its prevalence in the queer community. And they found an opportunity to discriminate, but they also found an opportunity to set these folks aside, to isolate folks and make them the boogeyman, if you will. So that's been a problem. So when parents, and we're talking about youth now, when parents hear this kind of information and don't have a lot of correct information available to them, they panic.
Hmm.
They put the kids out. You're gay and you're infected. We don't want you around. Get out. And so we end up with thousands, I mean, literally thousands of young people on the streets.
Yeah. Yeah. And bringing in that historical tie with HIV/AIDS, pretty dark time, but also very, very excellent point in terms of what can happen in our society when we don't care and love our LGBTQ plus youth, right? Because the diagnosis of HIV
Absolutely.
is super, super challenging, and anyone with that diagnosis needs support. And so it really is important that we build communities together versus isolate them away because of something they have or who they are, as you've pointed out. And I'm curious too, because your career has spanned several positions in the public health sector, including at different organizations inside and outside of government. I'm curious, how did you get started in public health? Was it going for LGBTQ plus youth and social justice and that mission that you were most dedicated towards at the beginning? Or did you sort of fall into that work?
Probably a little bit of both. I was living in Washington, D.C., which I consider like my second home. I was working for a member of the city council at the time. This was back in the mid 80s. And this is just when people were taking notice of the AIDS epidemic and how it was impacting communities there. And a group of AIDS service providers came to the councilman that I was working for, and they were asking if a bill could be introduced to protect physicians and nurses who are volunteering their time working in free clinics. There was no medical malpractice insurance available. And so what they were looking for was a way that medical malpractice insurance could be extended to cover people working in free clinics. Hadn't been done before. And so I was tasked with helping to create the legislation that passed the city council, with flying colors, incidentally, but to make certain that these doctors and nurses were covered under the city's medical malpractice insurance plan. And so it highlighted a lot for me and made me pay a lot closer attention to what was happening here. Because I mean, at that point, what am I going to do with this background in public health and emphasis on community health? I could work in community health centers, or I could work at the government level. And I ended up working at the government level.
Hmm.
But as I began to notice what was happening, I said I could do more. So I left my job
Hmm.
working for the city council and became the first ever deputy director for a clinic there called Whitman Walker Clinic, which was a major provider of HIV care in Washington, D.C. at that time.
Hmm.
And I began working for them, and I just kept going.
That's incredible. That's incredible. And a couple of things there that I'm curious now to just kind of mention. One of the things is that you did mention how you were in DC at the time. So you were living there, but you also wanted to help out with larger policy and larger protection for doctors and nurses who are helping the population. And
Right.
so that's kind of an example of how being in the community and seeing injustice, but also being in public health and like kind of marrying those things together, it sounds like, and saying like, this is what I want to address. This is something that's important to me. So that's what it sounds like. And I think that that's a pretty great reason to get into what you're doing. So that's great. And then another thing is that you mentioned Whitman Walker, and there are clinics around our country that are specialized towards providing healthcare for LGBTQ plus individuals. And Whitman Walker would be an example. And I think it's incredible that you were there as well. Clinics like Whitman Walker, Fenway Health, Howard Brown Health in Chicago. These are institutions that we need, and we need communities to be served by these organizations and leaders to say what directions we're headed so we can really get the care that we need to these communities. And that is what is so important and so vital. And there's areas of our country that don't have these places as well. And emphasizing care for those people and giving care to those people as well is a huge current issue in our country. So I think that's great. I actually know somebody from my hospital where I will train at who recently picked up a job there. And he focuses on adolescent medicine. His name is Terrence Willen, I think. So,
All right, that's great. That's great. I'm glad to hear that the interest is still there, because unfortunately you don't hear much about HIV and AIDS anymore, and yet the threat is still there. The disease is still there. The need for treatment is still there. The need for prevention messages is probably greater now than it's ever been.
Yeah.
And people need to hear that. This is not the time to relax, or drop your guard. This is the time to really pay careful attention and do everything you can. I hear that they're continuing to work on vaccines. And I'm hoping that within the next few years, some of these researchers are going to come up with a vaccine that people can actually take to immunize them against this disease, as well as cures for this disease.
Right, right. HIV is obviously something that we still don't have a vaccine for. We have vaccines for COVID. We have vaccines for monkeypox. We have vaccines for so many other illnesses and viruses, but we don't have one for HIV. And so the development of that vaccine will be a huge accomplishment. But when will it happen? And if and when that happens, who is benefiting from that? Are we creating a vaccine that is equitably distributed to people in the community and that everyone can benefit from, especially given, as we know, and I say on the podcast a lot, because HIV is coming up here, because another thing is that housing is considered a social influencer of health, meaning the zip code where one resides and the ability to reside in a physical home impact one's ability to access and benefit from healthcare. So I actually kind of wanted to ask you, now that we're talking about HIV a little bit, in what ways can you imagine someone living with HIV who doesn't have a home, how not living in a secure area is hard for them, given their diagnosis?
Oh, it's extremely difficult. I mean, one problem would be, how do you contact someone if you need them to come into a clinic for care? The other, and even greater issue is, we're talking about compromised immune systems. And someone living on the streets is doubly exposed to all kinds of other possible illnesses, and they can't fight them off. So that's another problem. And what do we do in terms of just surviving? We still have people who resort to being sex workers for the sake of surviving. Is there a guarantee that they're going to practice safer sex? No. So, you still have the possibility of a spread of HIV from, one person to another. So there's so many things that bounce off of housing. Being unhoused has so many health implications. Food is another one. Just general health care.
Exactly.
If you get a job, where do you go to clean up every day, to have a change of clothes, transportation to get you where you're going? All kinds of things play into that. And so it remains a huge problem, and we just have not addressed it like we need to. We really haven't. I go back to, again, back to Whitman Walker Clinic. In the early days, they launched a huge housing program to take care of people who were unhoused. And many places around the country still do that to this day. They offer housing programs to people. And if you've got a roof over your head, then you can begin to think and concentrate on a lot of other things that need to be addressed in your personal life. But if you don't have a roof over your head, anything goes.
Well said. Well said. A lot of things that someone can miss from their life or not be able to take care of because they don't have a home. And one of the things I want to mention too is storage of medications, because living with
Oh, yeah.
HIV is a huge challenge on also taking medications, taking antiretroviral therapy and taking a multitude of tiers of medications and having a safe place to store those as well. So,
Yeah.
definitely well said. And I want to note that our government has named housing and the neighborhood really that one lives in is a focus of Healthy People 2030. So we're starting to see a lot more focus on the environmental factors that affect health, and housing being one of them. So it's important to be mindful in this conversation, right? When we're talking about queer youth who are unhoused, also imagining queer youth who are living with HIV, or for that matter, any queer individual who is living with HIV and how they may face more discrimination from getting housing. So, anything else you wanted to add on that before I transition?
I always like to tell the story of a dear friend of mine that we went to school together in elementary school. So we reached way back. And, we lost track of one another by the time I got to high school. But then we reconnected maybe about 20 years ago, 25 years ago. And she'd come out. She was a lesbian and had been living with her partner. And I say her partner because they never got married. But she'd been living with her partner for over 40 years.
Wow.
And her partner died. And suddenly she was left out there with no legal recourse, over property or anything else. And what it resulted in was she had to pack up and move out. The family moved in and took over everything, and she suddenly had no place to live. So she moved into a retirement home. She was eligible for retirement, and she moved into a retirement facility. And because she was a lesbian, she was treated very badly by residents, by staff. So here you are facing discrimination, maltreatment, as well as dealing with grief. She committed suicide.
Wow. I'm
And
sorry to hear.
and one of the things that motivates me to this day to do the work that I'm doing is I don't want those kinds of stories to multiply. If we'd had a One Room Chicago building already in existence, she might have found shelter in that storm that was in her life, But there are other people out there like this. And so it's really important that we look at, it's just another issue around housing. Unhoused people can become very unstable people, and for legitimate reasons. And if we can do something, if we can be there for them, it makes all the difference in the world.
Certainly. Thank you for being honest, and thank you for being transparent about that story. As we know, suicide rates as well are very high among LGBTQ plus people. And I can only imagine this woman who was living with her partner for over, you said 40 years, is quite a long time to lose someone so dear to you. And then to be in a situation where now you don't have that person, but now you're even further isolated because of mistreatment from others. So as you pointed out, if a One Roof Chicago did exist, maybe that would be a place of solace for her. And I wanted to ask you, I do have a few questions about One Roof Chicago. I know that it's not built yet, but is it okay if I go into a couple of questions about it?
Absolutely.
Awesome.
I'm happy to talk about One Room Chicago.
Awesome. Awesome. Yeah. Yeah. I am curious. So I can only imagine to create a facility of this kind that permission has to be asked, or rather, coalitions have to be made, and conversations should be had regarding who is this for and like how should it be done. And so I'm curious about who are the stakeholders that contributed to the vision of this housing facility.
So a little better than 4 years ago, the originators of One Roof Chicago reached across the city and pulled together people from all walks of life that they thought would probably have an interest in something like this. And they developed focus groups and asked people to be honest and transparent about what they thought was needed to address the intergenerations of seniors and young adults in particular. So there were senior participants and there were young adult participants, and there were the community people of all kinds who weighed in and shared their opinions and their ideas. And that's what helped shape the concept that is now One Roof Chicago. I'm so happy to say that when we move forward and we put this idea out to our city leaders, for example,
Right.
they jumped up now and said, absolutely. What a wonderful idea. So we have the support of city elected officials, state elected officials. We've got the support of community leaders, and we continue to build, strong coalitions to this very day around this idea. The great thing about One Roof Chicago is that even though there are other programs, other services around the city and around the country that address some parts of this idea, our goal is to make it as holistic as possible. So we're talking about housing for seniors, and particularly for seniors who may have some health issues. And we're talking about housing for young people, for young adults who may have experienced homelessness, who may be unhoused or may have been unhoused, who may be marginalized for any number of reasons. And so we want to create opportunity for them. And so right now, for example, we're just launching a program called Workforce Development. We're going to create a cohort of 20 young adults that are going to go through a little over a year-long program to become certified in community health as community health workers. Now, we'll be in a position to call on them when we have residents that need healthcare services. We'll be in a position to call on them. And it's important because so many of our young adults don't have good linkages to our older adults. So it's an opportunity to bring these two groups together in a meaningful way. And so that's one of the ideas that we're looking at. In fact, we're even looking at possibility of workforce development for some seniors at this point. We had a conversation the other day and someone said, well, some of us old folks are ready to go back to work too, and so we want to make this available for them as well. But that's what makes our program a standout. You've got housing programs for seniors over here. You've got housing programs for youth over here. But who's bringing these groups together in a meaningful way? And we'll have mentoring programs and all kinds of exchanges so that, I'm almost 80 years old. And I love it when young people come to me and say, tell me about what it was like 30, 40 years ago in this town. What was the club life like? What was going on? What were the struggles like? And I can sit there and say, well, let me show you my child, and
right. You're like, well, I got a couple stories for you.
wow, exactly. I got a couple, and so it's really, really valuable that, for one thing, it makes me feel good that somebody wants to know about my past, but it also makes me feel good to know that I can share some stories that young people today can build on for themselves.
Right. Wow. I'm so excited. Oh my
I'm,
goodness. I hope
I'm,
people are excited hearing this. This is
oh yeah,
exciting. This is
yeah,
amazing. We're having communities, even within our community, come
yeah.
together, be able to speak, be able to fellowship, have the opportunity to learn and give people a safe space to do so. One of the things I really particularly liked that's related to this podcast is talking about how the community health workers are being trained right now. And
Mhm.
community health workers are shown to improve health and longevity of communities. They're shown to limit the exacerbation of chronic conditions like cardiovascular disease, like diabetes. And we have examples of community health workers all around the US, and especially in Illinois and Chicago, there are groups that exist to help with that certification. So I think it's amazing that you are already thinking about this. And I think that's what makes it more than a housing facility to me. Like what I'm hearing is like, I'm not just hearing people having a place to lay their head and wake up and cook and then go out and then come back. I'm hearing that this is a place for community, for gathering, for improving health and well being. That's what I'm hearing.
You hit the nail right on the head when you said community. That's exactly what we're talking about here. We're
Hmm.
talking about building a community. And the
Hmm.
exciting thing about this is that we're also reaching back in history because we're building this facility in the Grand Boulevard area, which is known today as Bronzeville. We're
Right.
building in that community. And the African American queer experience on the south side of the city and in places like Grand Boulevard is so very, very powerful and significant. And so what it does is it forces discussions. People that have been there for years come out, and I remember when so and so, was around and he was known for such and such, or she was known for such and such, and everybody loved him in the community. So what it does is it forces history to resurface. And I think that that's an excellent thing as well. For me personally, I was born right around the corner from where One Room Chicago is going to be, so I just
Oh.
love that. I love that idea. I have to keep reminding myself that you're a med student. And I'm so glad to be talking to a med student because for a lot of this, when we talk about health, you get it.
Oh, definitely.
Yeah,
Definitely. Yeah. So also it's full circle for you. That's
it
awesome.
is. It is full
Um,
circle.
to know that. And then also you touched on a very great point. Thank you for mentioning how another sector of the wider queer community, people of color, particularly on the south side of Chicago, are Black LGBTQ plus youth living on the streets or living from house to house and wondering what facilities, what places are safe for them to go to. And I know there are already places like Brave Space Alliance that
Hmm.
exist to help these communities. But it's amazing to hear that there is going to be another place for them in Bronzeville. So if anyone is listening in doesn't know what Bronzeville is on the south side of Chicago.
That's right.
Alrighty.
Yeah.
My last question about that is really what plans, if any, can you tell us about an expected date for opening or completion of this facility?
We're hoping 2025, 2026, that we'll be ready to turn ground and start building. I'm keeping my fingers crossed for that.
Yeah.
Um,
Yeah.
but I need to also let you know that adjacent to the residential facility is going to be a regional senior center.
Okay. Oh, wow.
Not unlike any of the other senior centers around the city. Our alderman, Pat Dowell, said we can get all of this done. And so it's helping to strengthen the engine, if you will, by building this senior center adjacent to this intergenerational facility. So all of that's happening at the same location, hopefully at 47th and Calumet. All that's
Great.
happening together. And like I said, the alderman is involved. Adjacent aldermen from other wards are involved. The city planning department is at every meeting. Public Building Commission is at the meetings now. The mayor's office has representatives in the meetings. So we're really excited, and we have no reason to fear that this is not going to happen. So when everything is done, you make the application for all the initial funding. You have to go through zoning. You've got to have an environmental study done of the land to make certain that it's clean. All those things have to be done, and all of those things take time. So when we look at it, we're a couple of years out, but those will be good years. Those will be very promising years.
Yes, yes, it already sounds like the plans are in motion. So basically, the senior center is going to be an even greater regional point of attraction for people who are older to come into fellowship and to have community. That's what I'm hearing as well. So it's bigger than the housing facility, and they'll be right next to each other. And another point that you've made is the tie in with government, right? To have that government buy-in, to have that support, and to have the alder person, like as you said, say, this is something that I support. That's the type of support that communities need to move forward. So we need buy-in from government, organizations, and the people themselves. I mean, this whole idea began with focus groups of, as you mentioned, youth and seniors. And so in considering that we started there, I can only imagine how great it will be, because the work originated from the community. And that's also something that I hope we do a lot more in healthcare and research, which is what I do, and in other areas of social justice, is really emphasizing what are the communities saying. So thank
Right.
you.
Sure. So a lot of what I've been doing, aside from the workforce development piece, which is extremely important, has been having small group meetings with people in the communities in and around where we're going to be. Just having, meeting with church groups and church leaders, meeting with neighborhood associations. And I learned a lot of this from what I had to go through in developing the Casa Q in Albuquerque, literally sometimes going from door to door, but attending, neighborhood associations as well, making certain that all the questions were answered, making certain that if anybody had any fears or concerns, I could allay those fears or concerns. If anybody wanted to be a part of this effort, we've got room for you. And so all of those things are what I'm engaged in right now, having these community meetings with people and building a larger and larger supportive presence.
Right, right. I'm glad that those conversations are happening. I'm glad that small groups are happening. And it sounds like you're starting from different smaller conversations on like a smaller scale, but that culminating to this big change that is occurring. And again, starting with the community, as we've talked about. So that's amazing. I'm super excited to hear what is going to happen. And can you give us the website where people can read about One Roof Chicago as well?
Absolutely. You can go to www.oneroofchicago, all one word, .org. oneroofchicago.org. You can get a link there to our newsletters. You can get a link there to our Facebook page, or you can just go right into the website and dig as deep as you want to. And you can send money.
Yes, yes, donating as well, because obviously with all of these changes, money is needed. So
Absolutely.
absolutely. My closing for our conversation, I'm so happy that we have been talking about so many different things, and I don't want to close, but I do have a question that I think is important for the person listening in. So what message do you have for the queer person listening in who may be without a home or at risk of losing their home related to discrimination against them?
Well, fortunately, here in Chicago, there are lots of opportunities. I always tell people that Chicago and the state of Illinois is like an island. We're surrounded by, a lot of hostility. Wisconsin, Iowa, Missouri, Indiana, Those are not very friendly
Mm-hmm.
states when it comes to our community. But
Mm-hmm.
Illinois and Chicago in particular have really done a good job of shoring up the defenses, if you will, so that people can feel more protected here and that
Certainly.
services, can be accessed. So if someone is homeless, and I get calls all the time now from people who are asking if I can provide them with housing.
Mm-hmm.
It breaks my heart to say no. We're not open yet, but it makes me feel better to know that I can point them in the direction of the
Right.
services that can help them. There are other places that provide emergency housing, some places that provide long-term housing, for example.
Right.
And so I'll point them to, my sister over at Brave Space Alliance. She's on it. She is on
Mm-hmm.
her job. And I know if I send somebody there, they're going to get some satisfaction. So I
Right.
can point them to Chicago House and Social Services. I can point them to Life as Works on the West Side, depending on where these folks are. So all is not lost. There are lots of agencies out here that are out here for the purpose of meeting those immediate needs. So I just keep a list. And if it's something that I can help you with, I'll do that. If I can point you in the direction of somebody that can be of better help than me, I can do that as well. And I'm just fortunate, like I said, that I'm in Chicago because this is a great town for what we do and who we are.
Certainly. Chicago is a home, right?
Yeah,
For these
that's
people
right.
in the midst of, as you said, we're around a lot of disagreement and a lot of difference. But here, there's not housing, but there's a home. And when I say home, I also mean there are people, right? Because home is for some people, who are
That's
they? Who
right.
are they around? And
That's
having
right.
that support is huge. So I guess the bigger conversation is it's more than just where you lie, your head. It's also who you are around and who do you have supporting you. So that's amazing to hear. And thank you, thank you, thank you. Anything else you want to add before I close? And I'm going to also put some stuff related to what that person who I'm talking to can reach out to and what types of programs and services exist regionally and also nationally. So I'll try to put some stuff in there as well. But anything else you want to add to our conversation today?
Well, anyone who's listening before July 6th, please come out to the DuSable Museum for Black Pride. We're going to have a big space at Black Pride and have intergenerational discussions. We're going to have seniors there that are going to be available to sit down and have conversations with young folks and have good exchanges. So that's one of the things that we're going to be doing at Black Pride this year. So I'm excited about that.
Yes, I'm excited about that as well. I hope I can make it. I will
Uh,
definitely try to check it out. I'm definitely going to be here in Chicago. So, and another thing is Pride is coming up. So, happy that that's coming around and it'll be a time to celebrate. Definitely.
it will be. It will be. Yeah.
Alrighty. At this time, I'm going to end the recording, but if you want to talk a little bit more, we can totally do that. I'm just going to end the recording now. Thank you so much, Jim.
Oh, thank you, Renee. I love this opportunity.
It's true that where there's a house, there's a home. The efforts of Jim Harvey and others like him to create sustainable, thriving communities for LGBTQ plus individuals across different ages and backgrounds speaks to the incredible activism that allows queer people to live with less worry. One Roof Chicago provides the perfect example of not just a physical location for dwelling, but also a place to create new human connections, to fellowship, and to commune. As more and more centers for LGBTQ plus individuals are built, it's enriching to witness how these places bring people together. I feel personally driven from this conversation, as Jim clearly has a heart for speaking to the youth within the queer community. I find so much wealth and importance in indulging the experiences and stories from those who came before, the ones who were around when Stonewall riots began, survived the horrors of the HIV epidemic, and now are giving back in ways they could only dream. We need cross-generational discussion of how to improve the housing crisis, as well as many other crises impacting the health disparities that the queer population experiences. Thank you for listening in and/or watching. If you would like to read more about today's organization, please visit oneroofchicago.org. You can find references for our conversation in this episode's biography. Let's continue to push the conversation more on Instagram at Equerity Podcast, Twitter at Equerity Pod, or on TikTok at BEQ Pod, where you can watch clips of our conversations and comment your thoughts. If you had liked what you had heard today, please give a quick star rating on your preferred listening platform. Take care and see you in the next episode.